Okay, for the sake of time, because I know this team has a great presentation for us, I'm going to go ahead and get started today. But thank you so much for joining us in our biweekly recurring Research and Progress webinar series. I am Carrington Lott. I'm the Deputy Director at Systems for Action. And if you're not familiar with Systems for Action, we are a national research program office funded by the Robert Wood Johnson Foundation, and we're housed at the Colorado School of Public Health in the Health Systems and Management and Policy Department. One of our main activities at Systems for Action is to develop and release annual funding opportunities, soliciting ideas that are researching innovative ways of aligning the public health, medical, and social service systems. We've funded about 55 projects to date, and today you're going to be hearing about one of those projects. Just for a little context, this team applied for our funding opportunity back in 2023 and was funded for a pilot project. So a 12-month study looking using youth-based participatory research methods to align systems to better serve youth experiencing homelessness. And they applied for a follow-up study after that and received a 3-year grant doing more impact kind of measures. And so today you're going to be hearing about their project and how they're advancing equitable data ecosystems at the intersection of housing and health. And I think this team is they presented in our Research in Progress webinar series many, many times, and they're very familiar and comfortable here on the stage. And I know they have some great research to share with you. Before I get started, Jana, is the next slide an agenda slide?
No, not
Nope.
yet.
Okay, that's perfectly fine. We'll just leave it right here.
Sorry.
Before I hand it over to the team for their presentation, I'll just go over a few housekeeping items. The first is that we will save time at the end of today's presentation for questions. So if you have any questions at any point during the presentation today, please locate your Q&A box at the bottom of your Zoom screen, pop your question in there, and we'll make sure that we save time to address those. And we always record these sessions. So we will share out the recording as well as a PDF of the PowerPoint slides and any other resources that the team shares during the presentation today. So you will receive that after the presentation. And I think that is it for my housekeeping. Jana, I'm going to go ahead and hand it over to you and your team so you can introduce your project and introduce all of your team members as well.
Hi there, my name is Jana Gortz O'Brien. I use she, her pronouns. I am the principal investigator of the Youth Health and Housing Lab, which we will talk about here in a little bit. I have a wonderful team with me presenting today, and I'm going to ask them actually to all introduce themselves, if that's okay, if folks are willing to. So we have a group of youth, our youth organizer, and also our project manager for one of the arms of this project. I'll pass it to Luciana.
Hi, everyone. My name is Luciana DiBiagio. My pronouns are she, her, and I am the project manager for the data systems alignment part of our project. So I'll be talking to you all a little bit more about that today. And I guess we're going to be I'll pass it to Emmett next to introduce himself.
Good morning, all. My name is Emmett Dysart, and I am a member of the YAB, the Youth Action Board for the Youth Health and Housing Lab. I will pass it to Zainab.
Thank you, Emmett. Hi, everyone. Good morning. My name is Zainab, and I am a research assistant and the youth organizer in the Youth Health and Housing Lab. I work hand in hand with our wonderful Youth Action Board, so super happy to be in this position. And Lenary, if you're comfortable to introduce yourself, I'll pass it on to you.
Hi, I'm Lenary, she, her for the pronouns, and I'm working with the Youth Housing Lab.
Cool. And then I do want to just say thank you also to Megan Ford and Dr. Sam LeBeuf, who are both here today and members of our team as well. The team you just met will be presenting here. All right, thank you. Okay, this project was supported, as you heard, by the Systems for Action grant from the Robert Wood Johnson Foundation, and we have no conflicts of interest. To briefly provide some background before we dive into this conversation, the reason why we do this work is because 13,000 youth experience homelessness annually in Minnesota. This is similar across rural and urban areas and represents a range of experiences related to housing and homelessness. Youth experiencing homelessness hold diverse identities. 73% identify as BIPOC, 23% identify as LGBTQ+. So again, homelessness disproportionately affects youth with marginalized identities, and that is a result of multiple systems and structural failures. There are many health risks associated with homelessness, but whenever I hear about these health risks, I always kind of reframe that these health risks that we talk about are also associated and primarily a function of marginalization and trauma. So it's not necessarily the homelessness itself that amplifies these risks, though certainly the experience of housing instability does magnify these. Marginalization and trauma are really the root drivers in many of these cases for that increased risk of sexual health risk, violence, injury, abuse, chronic untreated medical conditions, mental health risks, and suicide and substance use. So you'll hear about how we work as a lab to address some of these today and why we do the work we do. As a lab, we are the Youth Health and Housing Lab, as you heard. And what we do is we work at that intersection of housing and health to bring systems together and advance health equity among youth experiencing homelessness. And we do this work alongside youth experiencing homelessness. To do this, one of the vessels we use to engage youth is that Youth Action Board that Emmett and Linary talked about. Our Youth Action Board includes 9 to 12 youth from Twin Cities and Greater Minnesota. They meet monthly, sometimes more often. They support our lab and work directly alongside our lab in project development, implementation, and dissemination. They're truly involved in every element of the work that we do. They participate in trainings and they actually co-teach trainings with us and workshops to further strengthen the skill set and also to advance the work. And they co-facilitate, co-train, and co-present too. So they are vital members of our team and we treat them and value them as we would any member of the team. And actually, we believe that their expertise is vital to the work and essential to the work that we do. In addition to the Youth Action Board, one way that we advance systems alignment is through what's called our multi-sector consortium. This is a group that brings together folks from across different sectors in the spirit of the work we do in Systems for Action. This includes youth serving agencies like shelters and housing programs, healthcare organizations, governmental organizations, schools, and our university. It brings folks together and then puts youth at the center of those systems. Why am I sharing this? Because the work that we're doing through Systems for Action includes 3 aims and the Youth Action Board and our multi-sector team are kind of the hub for this work and we collaborate to do this work together. Within this project, there are 3 aims. Aim 1 is to scale and implement a healthcare systems map, which is a digital online map co-created with young people called Youth Health Connect. That is Aim 1. That is not the focus of today's conversation. Today, we're focusing on aims 2 and 3. Aim 2, and both of those focus on creating a more equitable data ecosystem. Aim 2 involves advancing youth-driven trauma-informed data collection and sharing between and across systems and within systems. And Aim 3 involves leveraging existing large data sets to inform policy and practice with youth at the center of that data systems and that systems change. So today's focus in summary is on this aims 2 and 3 area, and it's how do we uplift youth voice to create a more equitable and youth-driven data ecosystem. And this goes hand in hand with that Youth Health Connect work we're doing to help bridge youth and youth serving agencies with healthcare and public health supports. So these two are essential, they go hand in hand, and that's the work we're doing with this grant. But our focus today will be on the data systems piece that actually Luciana leads. So our learning objectives for today's conversation. 1, we're going to describe 3 strategies that we are using to uplift youth voices across the data ecosystem. 2, we're going to outline preliminary findings from this youth participatory action research study to create a more equitable data ecosystem. And then 3, we're going to briefly discuss some challenges and opportunities to engage youth voices to generate a more equitable data ecosystem in the future. So we'll talk about those next steps. I'm going to pass the torch here to Luciana, who's going to take us through 3 of those strategies. Luciana, are you ready to take over?
Yes, thank you, Jana. Hi again, everyone. My name is Luciana, as Jana mentioned. And we're going to start off by talking a little bit about Aim 2, which relates to trauma-informed or youth-friendly data collection in youth-serving agencies. So youth that we work with have identified that when they're entering in youth-serving agencies, such as youth shelters, they're being asked a lot of personal questions, reliving traumas, and just having to share a lot of personal information. And from a research context, we're labeling that as data, but in reality, that is youth stories, their experiences, and having to constantly relive that and reshare that when they're entering in agencies seeking help has been a barrier. and bare minimum, a very uncomfortable process. So our purpose is to use semi-structured interviews with youth serving agencies, staff, and leadership just to figure out a little bit more of the why. Why is this information being asked? How is it being collected? Who is it being shared to? And where is youth voice centered in that? Or if it's not, how can it potentially be centered in that? So we can just, like the slide says, outline ways that agencies are currently using trauma-informed principles or maybe not, and identify some best practices. So methods. So like I mentioned, we're doing interviews with youth serving agency leadership, or youth serving agency people who main role is to store data, export data, and also in interviews the staff who are actually doing intake themselves, people who are more on the ground and have awareness of how the intake process actually runs. And then we're also working with our youth to engage them in the analysis of what comes out of these interviews, what themes are important to them, what are they identifying as something that would be interesting to explore further, that sounds correct, that sounds right, and again, to inform best practices. So some of the topics that are coming up in all of these interviews are, first and foremost, health concerns. We're interested in when a youth enters a shelter or a youth serving agency, what health concerns are they mentioning? What's being brought up, sorry. And we found that there's sort of three main buckets, the first being mental health, the second being physical health, and the third being substance use concerns. And it's interesting because certain agencies have internal services, whether it be mental health or medical services that they can offer to youth. And then some agencies have community partnerships that they leverage in order for youth to have access to basic needs. A second main topic that's coming up is just the intake process. Like, what does a youth go through from the moment they walk into that door to the moment they actually enter programming? We're talking a lot about data storage or information storage. When youth are self-disclosing and sharing their personal information, how do you store this? Are there best practices for how it's being stored? And a little bit of the why behind that is because we find that when there is appropriate data storage, there's less likelihood that a youth will have to be re-asked over and over and over again the same personal questions and potentially having to relive traumas with staff at shelter. Another main topic is data sharing, which has also gone hand in hand with funder reporting obligations. We're seeing time and time again that the reason why agencies are sometimes collecting information is because funders require it. So what does that process look like? And then lastly, trauma-informed practices. So practices that youth serving agencies use in order to keep youth at the forefront of their policies and procedures, or even barriers to that as well. So that's like a summary of what's coming up. So the first main chunk, the first main research question is the data intake process. Some common themes that we're seeing come up is the use of screening tools. So the use of structured assessments and tools in intake, whether this be an intake packet that the agency has created themselves in order to ask youth basic questions that they need in order for them to enter programming or in order to meet funder reporting requirements, or the use of screeners related to physical health or mental health in order for youth to be able to access more specialized services as they continue in programming. Another main big topic is meeting basic needs. So intake is often about stabilization when youth enter into programming. So ensuring that youth's basic needs are met. And I think this quote kind of summarizes that. It says, if it's 3 a.m. and the youth is tired, like we're going to get to the basics, and then we might allow that youth to sleep and then finish in the morning or something like that. So acknowledging that youth are entering into these agencies with stories and lived experience, and just identifying that, okay, maybe we can pause that intake process for a little bit, that data collection process for a little bit, so they can just have their basic needs met, whether that be shelter, food, water, or just space and time for a break, which has increasingly become more of a best practice. And then another main chunk is data storage practices. Common themes are mixed paper electronic records, which sounds maybe rudimentary, but again, when systems aren't fully digitized, it can result in asking questions that can duplicate efforts. And again, that is just burdening youth with having to relive stories or traumas, again, with staff. The quote, I think, speaks to that as well, just stating that the intake process is a paper process. The data evaluation team would love the intake process to be electronic, but it's just not at that time. So they're filling out pieces of paper and then translating that into the system. It's really duplicative. Another main theme is just, the documentation of procedures. There's a lack of standardization across agencies. And then some topics about staff viewing data entry as burdensome or even disconnected from care. Staff entering in these roles ideally to work with youth and be with youth, but there is that data collection piece too. We're hearing that this information is tied to a pot of money funding. So in some cases, viewing it as almost like a necessary evil. Another big question is data sharing practices. Main themes are external data systems. So youth serving agencies having, collecting their own data or youth's own information and then having to upload it into external systems on either like the federal or county level, again, in order to ensure compliance and funder reporter obligations. Again, funder reporter obligations coming up a lot in these interviews. Increasingly a theme of like that's the why behind a lot of this data collection. And then some about confidentiality and privacy. Our youth being told that this is their personal information and they do have a right to access this should they want. And I think there's a lot of room for growth in that area as well. And again, this quote kind of shows that this particular agency has 2 people whose job is dedicated to produce reports for funders, and funders can request anything, counseling notes, HR files, and they're being asked to produce anywhere from 10 to 20 reports a month, and how that is just cumbersome for the agency in order to keep up with that. And lastly, and a common theme within these interviews is trauma-informed practices. So trying to figure out, does the agency offer training to staff on trauma-informed care? Are there any organizational policies or procedures related to trauma-informed care? How does an agency view youth when they enter in shelter? And common themes are following a youth lead for self-disclosure. So not forcing, not pushing before a youth is ready to collect more information, but allowing them to open up at their own pace. Or in some cases, even ensuring that staff hiring practices are representative with people who have lived experience of homelessness or people from different social backgrounds, different racial backgrounds, for example. So ideally, a youth can maybe have a staff member that represents them or maybe looks like them, who they would maybe feel a little bit more comfortable opening up to. Emotional safety before information gathering, kind of tying in with the meeting basic needs before getting into the procedural element of entering in a program. And again, tensions between trauma-informed care and data demands and funder reporting obligations. This quote in particular is from an agency who requires a referral in order for a youth to enter shelter, as opposed to it being a walk-in youth serving agency. And it says, I try not to be too prying and make a youth relive traumatic things on the phone when they're seeking shelter. They're calling and they're trying to get into shelter, because I want them to feel safe to come here and deal with that kind of stuff. So trying to acknowledge we have questions that we need to ask, but can we maybe do the bare minimum so they can at least get here and feel safe to maybe open up once they're here? So yeah, these are some main themes that are emerging right now. And I'll pass it to some of my colleagues for a youth voice question.
Thanks, Luciana. I'm going to prompt the youth here with us today, Emma and Laneri. I want you guys to consider the intake processes at shelters and other youth serving organizations, especially ones that you've been that you've gone to or you've had friends gone to. How do you think they could be improved, and why is it important to include youth voices in this entire process?
Could go first. So again, my name is Emmett, and in regards to this question, like my intake at different youth shelters, or in Minnesota, we have this thing called coordinated entry, which is like another youth serving agency to help youth get like housing. Um, if I were to like summarize my experience for the intake process, it would be pity. Um, I always like went in to these meetings kind of like feeling like a lost dog, and it always kind of forced me to like portray my story or my family in this less than kind of mentality, and it never made me feel good. I always kind of just remember feeling gross after intakes. Um, Soggy would be like another word to describe that. Um, Outside of like reliving trauma, I constantly had to repeat myself because the intake for like coordinated entry, for example, like would expire before they like found me housing. So like I had to do 6 different coordinated entry intakes before I finally got housing over a 4-year period, which honestly is just ridiculous, but it is what it was. As far as like improving that, um, my little sister and I were kind of going through the thick of things together. And sometimes, like, the way they would ask questions, not necessarily what they were asking, specifically to like sexual harassment or neglection, in those in that area, like I like was able to like overcome like different things, but like I would see them ask my little sister those same questions, and like I said, it wasn't like what they were asking, but like how they were asking. There wouldn't be like a softball, like, hey, we're about to ask you something pretty, serious. They would just come out and like flat out say, like, have you ever been raped? And like that's really gruesome to ask a youth in those words. And so like my sister would like break down and we'd have to like pause the whole thing. And it was just like always just like rough. And like I said, soggy. So it's important to me to include youth voices in this process just to kind of like help navigate some of those things that like you would think would be almost common sense to just like include in the youth workers scope. But yeah, that's my answer.
Thank you, Emmett, for sharing that with us. Linnea, do you have any thoughts that you like to add, or if you want to build off of what Emmett was saying?
Yeah, the only thing I want to say is I'm gonna piggyback off of what Emmett said about how they ask like a lot of questions that could be, traumatized. Can you guys hear me?
Yes, we can.
Okay. So yeah, they ask a lot of, traumatic questions, and they don't really have like the resources right then and there, like maybe a therapist, a psychiatrist, just something to like back the youth up after, having to relive their traumatic experiences. So I feel like that's the way they can improve. And then with like the whole time wait, they'll rush you to do a coordinate entry just for you not to be housed until 6 years later. So that's all I have to say on that.
Yeah, thank you both so much for sharing your thoughts and for having the courage to bring up what you both talked about. We appreciate you so much. And again, like Janice said earlier, this work would not be where it is without you guys and the rest of the Youth Action Board.
Yeah, I want to add something to that. Emmett and Lenary, I think your stories are so common. These aren't like unique events or one-time things. These are across the board when we hear from youth about what these intake processes look like, they're really difficult. So when we think about data systems alignment and how we get data systems to work better together, it really starts from the moment that the data is being collected. So we cannot in good faith use these systems until they actually center youth voices in a trauma-informed way. So um, I just am immensely grateful for Emmett and Larry for being here and for both of you just kind of pushing us to do this work and to make these systems better too. So thank you for sharing and for being willing to be a part of this conversation. And then I think Luciana's going to share some plans for next steps.
Yeah. Um, Piggybacking off of what Emmett and Linary shared when it comes to next steps, it does start with generating youth-guided recommendations for systems change as it pertains to data intake processes. You know, we're hearing more about what's happening within the agencies, trying to understand the why and the how, but next steps are just continuing to work with our lovely colleagues in figuring out like what are actual best practices that would center youth voices and feel better for youth, and sharing that with organizations as well, and working with these the leaders and the staff at organizations to standardize that a little bit more, because if it's working really well at one place, we just gotta work with the broader community to share it with all. So a little bit about next steps. Um, and then we can move to another aim that we're also focusing on, which pertains to leveraging large data sets for youth-driven advocacy. So the methods behind this are we're working with our colleagues from the Youth Action Board to generate research questions with existing large data sets that collect information on youth experiencing homelessness. We're currently working with a data set called the Minnesota Student Survey. It is a large data set delivered through Minnesota schools, and I'll explain a little bit more about that after our next youth question.
Thanks, Luciana. Before we talk more about these large data sets that exist, question that we wanted to ask the youth is what is it like being a part of this research process, especially with large data sets existing about youth and youth deserving to be included in how they are designed and how the data is used. What are some of your thoughts, Emma and Laneri, about the whole research process, the translation process, the dissemination, and all that?
One way I'd put it would be empowering, to say the least. And like knowing that my voice is seen and heard is rich and it's long lasting. One thing that I came to a realization about by being a part of this process is that I have lived experience, but I also am a lived expert of my experience, and distinguishing the two is important. And like I said, came to realization about that by being a part of this process.
Thanks, Emma. Lanier, do you have anything that you want to add on to this?
Not at the moment.
All right. Thank you.
So the Minnesota Student Survey is an existing data set. It's a triannual census of youth health and well-being administered through public schools, charter schools, and other settings in Minnesota. It began in 1989, and it asked questions to 5th, 8th, 9th, and 11th graders in Minnesota. The 5th graders are not asked sensitive questions. So the data that you're seeing is going to be pertaining to like substance use rates. So it wouldn't be asked to the 5th graders in this data set. And it's similar to the CDC's Youth Risk Behavior Survey, which is on a more national level. Yeah, it's just a really rich data set that collects a lot of information. So some of the main buckets of information. Jana, you want to go to the next slide? Yeah, some of the main buckets of information are there's questions about identities. So assigned sex at birth, gender identity, racial and ethnic identities, school engagement. Are you engaged in after school activities? You know, do you have any plans for after high school? Mental health and substance usage, and also treatment or history of treatment, violence, safety, hardship, and perceptions as well. So not only asking, do you use X substance, but what is your perception of harm from usage of this substance? Or what is your perception of your peers using this substance? So some really interesting questions. And our youth colleagues have identified that they are interested in learning a little bit more about youth substance rates. Those who have experiences of homelessness compared to those who do not have experiences of homelessness. They are also interested in seeing this divided by location as well, and also by race or ethnicity. So these are some of the analyses that we're currently working on in collaboration with our youth colleagues, like driving the research question and the why. So this is an example of some of the analyses that we're doing. So this is a map of Minnesota, comparing rates of past year prescription opioid use in 2022. So you can see that the percentage of those with experiences of homelessness are running away are the colored figures, compared to youth who have no experiences of homelessness or running away. And you can see not only the contrast between those who have lived experience and those who do not. You can also see it broken down by school location within the state. And then these are the type of questions that we bring back to our youth colleagues. It's like, you know, why do you think the rates look like this in these areas? Or you know, I feel like there is a popular notion of, you think maybe there's a lot more substance use going on in urban communities, but that's not always the case, actually, if you look at some of the rates. So trying to get to the deeper why behind some of this. And then on the next slide, you can also, yeah, there was some information about marijuana use as well, compared regionally as well. And then to piggyback off of like marijuana usage, rates. We are trying to leverage these existing data sets that collect this information about youth for youth-driven advocacy. So we've partnered with an organization called Cannabis Awareness and Education, or CAKE, which is a youth-driven initiative that focuses on cannabis education and awareness. And the reason why this partnership even began is because of our colleague Emmett, who is not only involved with advocacy with us, but also with them. So yeah, I want to also give space for Emmett if you want to talk a little bit about Cake, and just share a little bit about some of what you guys do too.
Yeah, definitely. Thank you for including us in this presentation as well. So, um, the acronym again for CAKE is Cannabis Awareness Education Council for Youth. Some friends and I, back when cannabis became recreational in Minnesota, in 2023, we all came together and read the bill and realized that there wasn't much talk about youth in the bill. So we kind of got in the political realm of things and was able to like make some noise at the Capitol, and get our recommendations turned into bill language, one of which passed. So that was like a big win for us at the start. A few different organizations kind of got wind of that and decided that they wanted to partner with us as far as creating curriculum, one of which was Alina Hospital. And so we just kind of finished up wrapping up some curriculum building with them. All across the state, we've been able to like hold listening sessions with youth and just kind of get their concerns, curiosities, and questions about cannabis, and also collect data. In regards to partnering with the U, we had them kind of look at the Minnesota Student Survey and give us like some data in regards to some of the things that have been said already. And so we're looking forward to like really like helping use that data to tell a story, as well as looking forward to using the data from this year because the surveys took in every couple years, and 2025 was like the newest round of that. So there should be some more data coming out pretty soon, and like kind of comparing, contrasting that data to the data from this year. And now that it's recreational, kind of seeing how youth are interacting with it. With like the recent federal ban on hemp, if people aren't really familiar with that, like that's like another really interesting thing about it, because a lot of times youth aren't like necessarily smoking the flower cannabis. They're getting their hands on like edibles, the drinks, or like even vapes and cartridges. So those are like other areas that we're now beginning to like focus on. And yeah, so that's just a little bit about cake. If there's anything like I missed or you're curious about, I could also go into that. But thank you for
Yeah.
sharing.
That was perfect. Luciana, do you want to take us through some of the data that we pulled with Cake?
Yeah, of course. Do you want to maybe go back one slide?
Yes. Sorry.
No, that's okay. I find this one very interesting. And this is an example of some of the data that we've looked at with Cake in order to inform their education sessions that they do surrounding cannabis with young people. So in this image, you can see on the left-hand side, students were asked in the Minnesota Student Survey, have you ever used marijuana at least once? So the figure is very small. I think around 9% of students said yes, they have used marijuana at least once. The figure to the right is perception. So they were asked, do you think your peers are using marijuana? 56% approximately percent of youth think yes, my peers are using marijuana. So that's a big discrepancy of who is actually using, and then perceptions of use. And what does this mean? So this is some of the information that we're sharing with CAKE for their education, their cannabis education. Another interesting figure here is marijuana usage by mental health status. So you could see the dark bar is they did indicate a mental health challenge. The light bar is they did not indicate a mental health challenge, because remember the MSS asked questions about a wide range of topics. So you could see marijuana usage is consistently higher for those students who have indicated a mental health challenge, and significantly higher for students who have attempted suicide within the last year, like starkly higher. So again, just striking figures to be aware of surrounding cannabis education. And then just some overall findings of some of the cannabis-related analysis that we're doing in partnership with CAKE. Minnesota rates of marijuana use are less than the national average, 9.4% versus about 29.5%. As grade increases, students think the risk of harm by using cannabis actually goes down. So, marijuana use varies greatly by race, ethnicity, and also school location, as well as some stuff related to mental health or co-occurring mental health challenges too. So as for next steps, translating these findings to action through youth-driven advocacy, like partnership with CAKE, and just sharing this information across like our multi-sector partners, and additional youth-driven analysis too. Like this was the first round of asking our colleagues what's important, what's pressing, what do we need to look further into, and we'll just continue to do that as well, and also share it for policy advocacy and change at a higher level.
Thank you, Luciana.
Yeah.
And thank you to everyone who contributed to all of this work. It's truly been a team effort driven by young people. So far you've heard about a strategy whereby we're trying to really map the landscape of current data systems and how data is collected and improve those systems at the point of service. You've also heard about leveraging one existing large data set, and we will continue to do others to actually put those data in the hands of young people and then use them and leverage them in a way, to translate research into policy in a way that aligns with youth values and goals and interests. And then this third piece kind of puts it all together. It addresses both, it comes from both AIM 2 and AIM 3, and it's about uplifting youth voice across the data ecosystem. So we've been sharing a little bit about that, but I want to dive a little bit deeper into this piece. So right now what we're doing is we're trying to build trust and connection with existing data collaboratives and systems leaders. So we already have access to some electronic health record data. We have access to Minnesota student survey data, and we're in partnership and in close contact with the folks who run a data consortium that brings together housing management system data and healthcare system data too. So basically, we're talking about how all of this data is getting collected, but we're trying to think about how to get the systems to be better interconnected with one another. Where we're at right now is that we're convening meetings with the people who run each of those data systems, and we're bringing youth and trying to engage youth in those meetings, and then we're advocating for youth voices and representation within each of those elements of the data ecosystem. So this is very much in its early stages and will be informed by both of the other two elements, the large data systems work and also the interviews and the qual analyses that we're doing. Some preliminary findings are outcomes that we're seeing already. We're working to build trust in the context of a very charged social political climate. We presented at APHA a little bit about this because this is American Public Health Association, I should say, a little bit about this. Essentially, right now, there's a lot of pressure on data systems to remove elements that may be politically charged or socially charged. Some examples include gender modality items and other equity-related data elements. So there's been a push to preemptively remove important equity-related data elements. And there's been a big tendency among most of the electronic data systems to really preserve their data and be mindful about who can see it because for fear of retaliation or for being defunded. And we talked a little bit about this being a challenge and also an important finding as we're trying to do data systems work because it impedes data sharing between systems and improve data systems integration. Another thing that we're finding early on is that there is actually rising interest in engagement with people with lived experience, but a lot of people who are running the data systems don't have deep connections with people with lived experiences. And that lived expertise, though they recognize that it's valuable, youth are often excluded from the conversation altogether. So we worked with one data systems collaborative that is really excited about the idea of having a single chair on their board that would be preserved for people with lived experience, but they're like, how do we get in connection with people? And mostly they're thinking about adults. So really, how do we break in and actually get youth into those rooms and uplift their voices within those rooms so that the data systems can be informed by young people? And when we think about some of the data that Luciana presented early on, there's this tension, an ongoing tension between trying to do trauma-informed and youth-friendly care and the need to collect all of these different data elements, most of which are driven by adult systems, as part of the intake process. So we're thinking if we can intervene and improve the types, those data systems to begin with, and really streamline the kinds of questions that actually need to be asked in the first place and limit them, that could actually really improve the experience for young people who are within these systems too. I'm going to ask for some youth voices here, if they're willing to. And Zainab, I'll ask you to help facilitate this conversation too.
Yeah, Jana, thank you. So as we're continuing to think about how to uplift youth voices, build trust, and sustain trusting relationships across data systems, how do you think youth should be engaged in creating the data systems with which they interact?
So my opinion about this would be that like people-centered approaches would be most appropriate for this. People-centered development. And so like meeting people where they're at and then kind of helping them get up to speed on how to interact with these data systems would be most effective as far as engaging youth.
Yeah, thanks, Emmett. I'm totally a big advocate for meeting people where they're at.
Yeah, I would have to agree. Meeting people where they at, and giving them resources that you may have used or you know about.
Thank you both so much.
All right. So next steps in this one, and I would say that this third aim is contingent, or third strategy is contingent on the first steps of aims 2 and aims 3 that we're outlining here. But two big next steps are promoting ongoing youth engagement and advocacy to improve the data ecosystem, engaging additional data systems leaders and partners in our multi-sector work. And hopefully, eventually, my hope is that there will be some best practices that emerge from this, like we were talking about earlier, not only related to the intake process, but youth-driven best practice, but also related to the data systems work and how we have systems work together to improve youth, to engage youth. All right. Key elements of our approach across the board, I just want to summarize. One, authentic collaboration with young people that starts from the very beginning of the lab's work, including planning, and then goes until dissemination and translation. Two, engagement with multi-sector partners and continuing to grow our multi-sector partners across the state. You've heard us talk a fair amount about transparency and trust building, which means open and honest dialogue with young people in the state and with youth serving agencies about the work we're doing. Leveraging trauma-informed practices within our own methodology, including the interviews and engagements that we have with young people, and then advocating and using clear and inclusive language across the board in everything we do. And again, this is a team effort, and we're all holding each other and working together, and all of our systems that affect youth experiencing homelessness are interconnected. So a lot of our work is about bringing folks together, and it would not have been possible without the collaboration and advocacy of youth in our community and also our multi-sector partners. So thank you to all the members of our lab and Matthew Stoffel, our administrator, for keeping us afloat as well. I'll pause here for questions and reflections. I think there is a way to do that in webinar form for the last 10 minutes.
Wonderful. Thank you so much, Jana, and everyone else on the team for presenting. That was wonderful to hear some of the updates and findings and how you're engaging youth voice. And I loved, Emmett, hearing your experience about going to the Capitol and reading that bill and having that impact. That was really great to hear. As Jana mentioned, we are in the Q&A portion of our webinar. So if you have any questions, now is your chance. I feel like as moderator, my usual question is, what are your next steps? But you laid that out so well for each one of your aims that I don't need to ask that now. I'm curious if you have any like surprising collaborations, or if anything in this project has, I guess, not happened the way that you have wanted it to, whether it was good or bad, that you want to talk about now.
I can share that one of the big challenges we've had is that operating within the climate we're in currently, um, with a very politically charged climate, has made it difficult to break into certain data elements of the data ecosystem. And I think there's just a lot of apprehension and like preemptive changing of even the data elements. So that to me has been a big surprise, because we're pretty deeply connected with these systems. I think people are really nervous about how their data is going to be used. That being said, we're working to build that trust and build those partnerships, and those connections are growing. I just think it's slower going than we thought. And I think what we're hearing over and over again from youth and staff are just about how distressing the intake process is and how challenging it can be, and recognizing that like are the data collection elements that we have built as multiple systems to try and serve youth are actually causing a fair bit of harm. So I don't think that's surprising, but it's really stark to see it laid out and hear it directly.
Yeah, that makes sense. I've heard that in other projects as well, that burden of intake in multiple different systems and just the questions that they ask and having to be asked the same questions over and over again. Okay, we have a question that just came into the Q&A box from Angela. Is there a teen home where the youth go in such instances? And is there an educational, vocational pipeline for youth in such programs?
I can speak to the shelter and education, the shelter system and the housing system, if that's helpful. And so essentially, I'm assuming they're saying in such instances like youth, when youth experiences homelessness. So if a young person is unstably housed in our state, we actually have a pretty robust network called the Youth Services Network that helps youth connect directly with available shelter, beds, and housing programs. So I'm actually currently located at the Bridge for Youth, where I'm the medical director. That's where physically I am right now. And youth can walk in and come here um, if they need housing and healthcare as well, and they help connect youth with basic needs. There's a phone number that they can call or text as well. I think though our system is pretty robust in this space, in this state compared to maybe other states, as you heard loud and clear, the system to get people from shelter to housing is really, really challenging. And even the system to get people into shelter can be challenging as well. Can be challenging as well. And there's lots of barriers for many, many reasons. And then there is an educational and vocational pipeline for youth called legislated nationally through the McKinney-Vento legislation. So there is funding for homeless liaisons within each of the schools. So even though that funding exists, not only is it being systematically dismantled currently by the federal administration, it also is relies on the school to have a homeless liaison that can help support youth who are experiencing homelessness. And that is often a challenge, especially for schools in rural communities and areas. And even in Minneapolis, we recently learned that there were two homeless liaisons, and one of them was actually cut from their position. Now there's only one, and only part of the time. So again, these are currently being cut across the state. And then I see another question.
Yeah, I'll jump in and ask. A technical question about speaking to the IRB process and any barriers that you might have had with having youth engaged in the program. And also, are you using AI to cut down on needing to submit duplicate intake info?
That's a great question. Yeah, so the IRB process, so youth experiencing homelessness are considered a marginalized community, and then youth under the age of 18 um, also present challenges regarding minor consent law. In our state, youth who are experiencing homelessness, who are apart from their home and managing their own money, can consent for their own participation in the study. So for youth who are participants, we've worked with our IRB to be able to have them consent for their own care. If they're not managing their own finances, we do need their parents' consent. This is rare in that population. And then in terms of youth as members of our research team, this has been um, a new element of our lab's work in the last year and a half, but we've actually been able to add youth as collaborators in our research team to the IRB. So they are actually co-researchers with us. And that has been like they are on the IRB and they are members of our research team, just like any research assistant would be, or any other member of our lab team, and they're paid members of our team as well. So I think our IRB, though it has taken a lot of advocacy, is now in a place where they will allow youth to be kind of team members and employees of the university when we're doing YPAR, which is Youth Participatory Action Research. And then no, we have not explored using AI to cut down on needing to submit duplicate intake info, though I'm interested in that in the like note taking and like translation element too to reduce some of that administrative burden. So thank you for that idea.
Jana, for adding youth to your IRB as co-researchers, were there other PIs or IRBs being submitted through your university that had already done that, or were you kind of trailblazing the way? And did they have lots of questions for you?
Um, so some of the youth we work with are young adults. So it's a little bit easier to do it among young adults because we'd already paved the way with research assistants who were in the undergraduate age range. So that works. But to my knowledge, this was our first time doing this with our with that anyone had done this with our IRB. They were confused at first, and they kept being like, "But they're participants," and I'm like, "They are participants, but they're the youth that are engaged in our study, like Emmett and Laneri. They are co-investigators with us. They are driving the research. They're helping us with analyses. They are involved in interviews, and we wanted them to be able to be in the focus groups and interviews we're doing across both sets of the project, the Youth Health Connect arm and the data systems arm. So they are now on the study.
Awesome. I see one more question. I think maybe this is the last one we'll ask before we close out our session for today. But the last question is, do you have data or info about how long youth on average stay with homelessness, or I guess are unhoused maybe? And is this shorter than adult cases?
I would have to get back to you on this one. I don't know the exact. I think a lot of youth homelessness, sorry, why don't we go back? The definitions of youth homelessness vary by system. So this is one element of systems work that has been a challenge to navigate. So for instance, the school-based definitions of homelessness have one definition of homelessness. The healthcare system and the public health systems and the housing systems have other different definitions of homelessness, which bring a challenge. So for instance, something like running away or couch hopping are experiences that we in our lab and as public health folks believe is an experience of housing instability and homelessness that we have shown in our lab through our other research dramatically increases health risks associated with that housing instability. So if we include all of the experiences of homelessness and housing instability for young people experiencing homelessness, then oftentimes youth experiences of homelessness are more likely to be transient, such as a brief runaway experience or being thrown out for a brief period of time.
Or being
So
pregnant.
or
Not to
being
cut you
pregnant,
off.
like exactly, being thrown out for being pregnant, being thrown out for being queer would be examples, and that's often a short duration, but sometimes it's longer. So I don't have specific data right now about the duration of adult versus youth homelessness, but if we are inclusive of the range of experiences of youth homelessness, I would guess that youth homelessness is often shorter. And then it's important to note that experiences of youth homelessness, even transient for 1 or 2 nights, dramatically increase the likelihood that a young person will become entrenched in a cycle of homelessness in adulthood. So one of the things that we're working to do as a lab is to prevent and end youth homelessness to begin with, which we see as a preventive strategy for chronic homelessness in adulthood, if that makes sense.
Yeah,
Yeah.
and to piggyback off that, I feel like it all depends on what the homelessness and like what the youth and adults are doing. You know, a lot of these adults out here that are homeless, they're on drugs, so it's going to be a lot harder for them to get home. I mean, housing. And then with the young folks, like even if they're on drugs, it's going to be a little harder for them to get housing too. And like Janae was saying, getting thrown out And even if you're pregnant, there's not a lot of homeless shelters for pregnant young youth.
Yeah. And 1 in 3 youth experiencing homelessness are pregnant or parenting when we look at this age range. So this is a huge challenge. And the number of shelters, there's only one in Minneapolis that is an emergency shelter. So one in the whole Twin Cities area, actually, that's emergency, and 2 housing programs total in the entire Twin Cities metro. And to my knowledge, they're the only ones in the state. So it's a real challenge too that prolongs homelessness as well.
Oh, that is good context to have. Not happy context, but good context. And I think maybe I'll close us out with highlighting even just that simple thing of how systems aren't aligned and the definitions of
Yeah.
what people are experiencing. I think that often gets overlooked and how that might impact sort of the care that they provide. So, Jane, I'm really glad that you touched on that.
And it
Again,
impacts the counts too. Yeah,
yeah.
I agree. Mhm.
But thank you so much for coming and presenting and providing an update. We will have this team again present at some point next year, so you can follow along with them and what they're learning. And we will send a recording of today's session as well as their PowerPoint slides. And just thank you for attending and listening. And we hope you will join us again in the future for another Research in Progress webinar. Bye.
Bye.